students. I am Dr. Soniya from BPT Department, Assistant Professor in RPIIT Medical and Technical Campus. Today, we will discuss about topic infrared radiations. Outlines are introductions, definitions, classifications of IR, productions of IR, luminous generator, non-luminous generator, physical behavior of IR, absorption and penetrations of IR, physiological effect, therapeutic effect, contraindications, and precautions and dangers of IR. So, what is the introductions? IR radiations are electromagnetic energy invisible to human eye. In the electromagnetic spectrum, the IR occupy the place between the visible light and the microwave. Wavelength 760 nanometer to 1 millimeter. IRR are emitted from any heated body. It produces heat when absorbed. IRR are divided into long and short wavelength for therapeutic purpose. Definitions: IR is an electromagnetic energy invisible to the human eye, having wavelength between 760 nanometer to 1 mm, used for the relief of pain, stiffness, and to enhance healing of soft tissue lesions and skin conditions by producing the superficial thermal effect in the tissue. Classifications of IR: the IIRs are subdivided into three groups. IRA wavelength 760 nanometer to 1400 nanometer, IRB wavelength 1400 nanometer to 3000 nanometer, IRC wavelength 3000 nanometer to 1 mm. Formal classifications: near or short IR 760 nanometer to 1500 nanometer, far or long IR 1500 nanometer to 15,000 nanometer. Productions of IR, there are two types of IR generator: luminous generator and non-luminous generator. Luminous generator को visible generator बोलते हैं and non-luminous generator is invisible generators. Luminous generators: the rays emitted from the luminous generator are produced by one or more incandescent lamps. An incandescent lamp consists of a wire filament enclosed in a glass bulb, which may be evacuated or may contain an inert gas at a low pressure. The filament is a coil of fine wires and is usually made up of tungsten, as the material tolerates repeated heating and cooling. The exclusion of air prevents oxidations of filament, which would cause an opaque deposit to form on inside of the bulb. The passage of an electric current through the filament produces heat, infrared, visible, and a few UVR rays. Luminous generator. These lamps are generally available with power level of between 250 to 1500 watt. At present, the generators that emit the luminous IRA are being manufactured. The lamps available at this time generally emit IR radiations with wavelength of between 780 nanometer to 1500 nanometer with peak intensity at 1000 nanometer that penetrate the dermis and subcutaneous tissue to a depth of 5 to 10 mm. The luminous generator are sometimes called as radiant heat. Second is, this is our luminous lamp. Second is non-luminous generator. These generators most commonly consist of a coiled resistance wire which is wound around or embedded in a ceramic insulated material and produce far infrared electromagnetic rays with wavelength 1500 to 12,500 nanometer. Non-luminous generator, it is also invisible to human eye. These generators are generally available with power levels of between 750 to 1000 watt. However, small generators are available with a power level of 250 to 500 watt. In this type, only infrared and no visible radiations are produced. Warm up and cool down period. So both the lamps require a warm period. Non-luminous lamp take a longer period than the luminous lamp to reach a peak level of heat emissions. The small lamp may take 5 minutes, but a larger one may take to 15 minutes to reach maximum emissions. What are the physical behavior of IR radiations? IR radiations can be reflected, absorbed, transmitted, refracted, and diffracted. What are the physiological effects? Cutaneous vasodilatations increase metabolic rate, decrease viscosity, increase collagen extensibility, stimulations of sensory nerve, sweating, consequent vascular changes. Cutaneous vasodilatations. When we apply heat, local cutaneous vasodilatations occur. Direct effect on vasodilatations. Vasodilation start after 1 to 2 minutes and local arrhythmia occur. Increased metabolic rate. According to Ventoff law, it states that the chemical changes are accelerated due to heat. When we apply heat, increase in temperature and increase in metabolism occur. Decrease viscosity. How did it happen? Increase in temperature, decrease in viscosity. Stimulations of sensory nerve. Thermal heat receptors will be stimulated in the skin so that the patient is aware of the heating. Sweating. With prolonged or intense heating, sweating will start to occur, leads to surface cooling as it evaporates. Therapeutic effect and usage of IR. What are the therapeutic effects? Pain relief, reduction of muscle spasm, joint stiffness, edema relief, skin lesions, and dermal ulcers. Pain relief. The heat produced by IR can be used to reduce pain by getting the pain transmissions by activations of cutaneous thermoreceptors or indirectly by the result of improved healing by removing the metabolites. Increase in nutrients and oxygen, decreased muscle spasm, and reducing the ischemia. The sensations of heat may also reduce the sensations of pain by altering the nerve conductions or transmissions. Use lower back pain. Joint stiffness. How it works? Joint stiffness results from shortening of ligament, joint capsule, and periarticular structures and alteration in the fluid pressures. IR, when applied, it will cause increase in temperature, increased soft tissue extensibility, and this effect, when combined with stretching and mobilizations, cause increase in joint range and decrease stiffness. Therefore, IR is used as a form of heat prior to stretching, mobilizations, traction, massage, exercise, and therapy aim at improving the joint range of motions. Use chronic stiff back following trauma, dysfunctions of lumbar spine. Skin lesions. Some skin lesions may be benefited by drying heat of IR. Fungal infections such as psoriasis may be managed with IR treatment. The increased temperature of the epidermis and dermis in the region of psoriatic plaque has been proposed as the mechanism for reduction of plaque when exposed to IR radiations. Dermal ulcers. IR has been used for the treatment of dermal ulcer. The purpose of such treatment was to improve healing by improving circulations, retarding bacterial growth. Contraindications. What are the contraindications? So, contraindications. What are the contraindications? Impaired cutaneous thermal sensations, defective arterial cutaneous sensations, area with defective arterial blood supply, local area of impaired peripheral circulations, subject with advanced cardiovascular disease, hemorrhage, superficial infections, and malignancy. Skin damage due to exotherapy or other ionizing radiations directly over the eye. Tumors of the skin may be stimulated to increase growth. Precautions and dangers of IR: burn, electric shock, gangrene, headache, faintness, injury to the eye, dehydrations, lower BP, skin irritations, area of defective arterial blood supply. Thank you. And don't forget to subscribe our YouTube channel, that is RPIIT Academics. And if you have any doubt related to this topic, you can mail me on sob@rpiit.com. Thank you.